We are experiencing a time of unprecedented transformation. The healthcare landscape is changing rapidly before our eyes. It takes courage to serve during times like these, especially when we don't always know what tomorrow will bring. But every day, through a combination of grit and determination, selflessness and dedication, time and talent, we are still making the impossible possible. That passion will continue to drive us to do the best we can for our patients and customers every day. We often share this mission through storytelling. Here's a look at some of your stories from the last year.
Tamer Ghanem is a surgeon from Detroit who re-sculpts the disfigured. He volunteers when he can get away, about a week at a time.
A lot of these patients had very severe injuries, such as severe, very extensive burns.
It must be frustrating for you to see these patients in so desperate a need and you not being able to help them.
Yes, it was very hard. Absolutely.
Especially the children.
Mm-hmm. Especially I have my own children, and it's very difficult to see children, with those injuries and their parents and how that affects them.
Hey everybody, welcome to YouTube. We are here with the top doctors, the top breast cancer doctors.
Well, it's a very good idea for you and your family to seek advice from a genetic counselor to see if they can identify inherited predisposition for breast cancer in your family or for other cancers. And for you, if there's multiple relatives, you need to be very aware of any breast changes, a new lump, a bloody nipple discharge. Seek attention right away.
Scientists are saying that a green sponge discovered more than a decade ago in the water off the coast of Alaska is showing promise as, get this, a potential treatment for pancreatic cancer. Dr. Fred Valeria joining us. He is with the Henry Ford Cancer Institute.
We found that this extract had activity in my system. It's a tissue culture system. And we found it has some interesting activity against both pancreatic and ovarian human cancer.
There is no more serious health crisis than being diagnosed with pancreatic cancer, where the average 5-year survival is only 8%. I had a chance to talk to five-year survivors to find out how it changed them.
It's amazing to be a care provider. It really is amazing to be a physician, to serve these patients. They come in with a smile and they come in with hope. And that is pretty inspiring and really makes our team be very grateful for the jobs that we have.
The ViewRay approach is completely different. Yes, it has that terrific precision, but at the same time, what it offers is the ability to finally see where the patient's tumor is located in real time.
Senator John McCain has been diagnosed with brain cancer, an aggressive form of brain cancer. Let's get more on his diagnosis and understand it a little better. We have the chair of neurosurgery at Henry Ford, Dr. Steve Kalkanis. So, doctor, let's talk about the glioblastoma, which Senator McCain has been diagnosed with. How common is this, though?
This tumor is actually very rare. Only about 17,000 people in the United States get it every year. So it is present in our population, but this is a tough diagnosis for sure.
Stroke is a #1 killer and disabler. There are incredible therapies and interventions that we now have at our disposal, and we've got world experts here and Henry Ford faculty so that we can transform stroke care here in Michigan.
Well, if you have epilepsy, the seizures can be so bad that it's nearly impossible to live a normal life. And the treatment, medicine. But what happens when that doesn't work? Well, here at Henry Ford's neurosurgery department, a breakthrough treatment that is changing the life of one Southfield man.
The medication was not working. We'd be flip-flopping between a whole different array of medications.
Desperate for a solution, Zaccoli met with Dr. Andrew Zilgit. He gave 2 possible options.
Epilepsy surgery becomes a treatment option. And for people who can't have a resective surgery or where we remove part of the brain, NeuroPace is an option for them.
NeuroPace, it's like a pacemaker that's implanted in the brain.
Every minute of every day, 39-year-old Jay Dunn battles with his body. A severe case of the movement disorder dystonia.
We're in the center of the brain, and there's this small structure called the globus pallidus. and we're putting the electrodes into it.
About once a month, Jay comes here to Henry Ford's Movement Disorder Center, where neurologist Sneepa Patel will adjust the stimulation, searching for better results.
Wine, women, and song. That's what 102-year-old William Hagen says are the secrets to a long life. And doctors at Henry Ford Hospital say this active lifestyle has helped him become one of the oldest patients in Michigan to receive a new heart valve.
Nobody would really consider doing anything because of his age, but I met him and he was young and at heart and vital and wanted to be active. And for those reasons, I thought that he would be a very good candidate for a non-surgical way of fixing the aortic valve.
We have a touching story now of 5 people forever linked by a kidney exchange. 3 of them gave a part of themselves to others waiting for transplant.
A tangled web of kidneys going who knows where.
These 5 folks were all part of a kidney exchange at the Henry Ford Hospital, and it started with Shannon Brink. So Shannon got Todd's kidney, Kara gave her kidney to Emily, and what about Sarah? Well, her kidney went to a woman in Seattle. The 5 and their family members gathered for the first time since the surgery in September. They exchanged hugs and thank yous.
Well, he's part of me now.
Yeah.
So
she's got my kidney in her.
my kid.
They tell us the moral to the story is,
if you're healthy enough to donate, look into it, consider it.
In Detroit, Simon Chowdhury, 7 Action News.
The resurgence of downtown, the resurgence of Midtown, the restoration of one of America's great cities. And it's a great privilege for me as an individual and for Henry Ford to continue to be part of that story. And so we're very, very grateful for this day and for what we are able to talk about.
The first ever bike share system in Detroit. It's a collaboration between the city, Downtown Detroit Partnership, Henry Ford Health System, and HAP. It's called MoGo and will include some 430 bikes at 43 locations in 10 different neighborhoods.
Proud to partner with the state, with Lieutenant Governor Calley, to add this cutting-edge platform into the clinical workflow for our 6 hospital system. This integration will allow physicians and those across Michigan to better protect and serve patients needing care.
2017 was the best year ever for external funding awarded to Henry Ford Health System. We received $94.2 million in grant and contract awards. The study I'd like to highlight is from Brian Amadani. He is doing a multi-site study taking our zero suicide model to see how it can be adapted to other healthcare systems.
For Mike Serafin's family, every day is Veterans Day, but today, something extra, something special, something beautiful.
Mr. Serafin, I want to salute you today in thanking you, sir, for all of your time served well.
This is something Henry Ford Hospitals started doing this year, a special bedside pinning ceremony for veterans in hospice care. A reading of the soldiers' oral history, a pin for their service, a salute. For many, it will be a last.
A heroic teenager suffers devastating injuries as he tries to help crash victims on a Detroit freeway. Tonight, Sean English is speaking out about that fateful night and his hopes for the future.
Sean has had part of his right leg amputated below the knee. Now, you'll remember he stopped to help another accident victim along I-96 last month when another car spun out of control and injured Sean and killed another Good Samaritan, Dr. Cynthia Ray.
And our last shout out is to Pod 1, the ICU. They've been so very grateful, and I'm gonna go through some of the name of the nurses because they made me laugh, even though when I was making them laugh because I was a little bit messed up the first few days. But Tabitha, Caitlin, Dave, Holly, Chelsea, Cheryl, Jacqueline, Crystal and Christine, and then emergency room for Jeffrey, because Jeffrey was an amazing help. So
the medical staff here at Henry Ford Hospital, can't really say enough about them from top to bottom. Whatever you're doing is fantastic. Please keep it up. Our experience here has been extraordinary as well.